Hey guys, Dr. Ben here. Let's go over some questions and I'll come up with some answers and see if we can come to some conclusions, come up with some ideas of how you or a loved one or a friend or family, whatever, can get healthier, can recover their health. Remember, when we're talking about Q&As, I love to have questions and you can come up with random things, whatever you want, but ultimately I want these questions to be something like, what is a game plan? What is the underlying cause? Why is this actually happening? As opposed to, what's the magic supplement for it? We can go over supplements, we can go over what might be helpful, might be beneficial, what research has shown, some of those things, but ultimately you've got to be talking about the why. You've got to be talking about why the body is out of balance. Hey Janie, great to see you. Pop down below where you're watching from. We love to see you guys all over the country, all over the world. We just sent out an email this morning, so check your email, check your junk mail if you did not get that. If you are not on our email list, send us a direct message with your email and we will get you on there. This was a really important email, so you want to check this one out. Hey Suzanne, we were talking about early intervention with viruses, but especially with COVID, and it's so important. We know that there's the prevention side and masking and social distancing and whether you get the shot or don't get the shot. Those are all things that it's going to. Hey Jolene, great to see you. Those are all things that you can do day in and day out, but ultimately you've got to be ready for that early intervention, because the last thing you want to do is wait until somebody goes into that hospital and then they are really sick and their pulse ox goes down and all those things. Hey Samantha, good to see you. So early intervention is key. We go in depth into some reports that are out there that we've seen do really well with patients. So thanks for jumping on. Drop those questions down below. We've got one already here, and this is Samantha. My sister has early onset osteoporosis and says it's hereditary. What tests for that and how to help prevent? So you can do some of the basic bone scans. They'll do the wrist, they'll do the lumbar spine, some of those things. Non-invasive, totally fine to do. It sends a little x-ray through there and it tells you how your bone density is. Everybody's bone density as you age, it goes down. So you're not going to be like a 20-year-old. And so when they say, oh, the 60-year-old has decreased bone density, well, when they're comparing it to that 20-something-year-old, yes, it is decreased. That doesn't mean that it's going to be full-blown osteoporosis. But if it's a significant change, or if in 5 years it's gone down dramatically, then you got to start thinking about that. Weight-bearing exercise is one of the best things that you can do. Unfortunately, sitting at our desk all day doing that is not a weight-bearing exercise. So neither is yoga, neither is stationary bike. Those are not weight-bearing exercise. You have to go for a walk. You've got to go for a hike. Up and down the mountain is great because that's going to add more gravity to your bones. Even doing some air squats, doing some jumps like that. Research shows that doing 20 air squat jumps per day. These nurses that did this study, it was like a 3% increase in their bone density over the time of that study. So doing some type of weight-bearing impact type exercise is really important when we're talking about osteoporosis. The average person that has osteoporosis is that smaller, thinner, leaner, 120-pound or less lady, and as they get older, they get lower weight. Most people, if they're overweight or larger bone, things like that, they're not going to get as much osteoporosis. It's not a definitive, but that's generally how that goes. Hope that helps. Stephanie, how to get smell back after having COVID? I think monoclonal antibodies helped me. We've had quite a few people we know that have used the monoclonal antibodies. If you've got access to them, if you have COVID and within the first 5 days you are not turning the corner, you want to make sure you're getting those monoclonal antibodies between day 5 and day 10. You definitely want it by day 10. If by day 10 you've already missed it, you could still get it, but you've missed that really good window to stop the cytokine storm, to stop you from really getting inflamed and ultimately going to the hospital. So monoclonal antibodies, yes, absolutely, you want to think about doing that. And so getting the smell back, I would do high dose vitamin zinc or NaC. So high dose zinc could be 100 to 200 milligrams per day. NaC, you could do that, dose it a couple times per day and see if that is helpful. We had somebody say that they had a chiropractic adjustment, their atlas was out of place, and that got their smell back after that as well. Is there a good supplement to help support memory issues? So it depends what the memory issues are coming from. If somebody has more of an ADD type of an issue where they're just distracted and bouncing all over the place, that's going to be more of a acetylcholine support, and that could be phosphatidylcholine, that could be some different nutrients that are going to help support that acetylcholine. Look into neurofeedback, do a brain map, see if somebody's brain pattern is more of an ADD pattern. If it's memory issues like with aging, then you have to start looking at reversing prediabetes, insulin resistance, metabolic syndrome, all of those things that we know are driving the damage to that brain. So for memory issues, you want to stabilize that blood sugar as much as feasibly possible, and then you want to make sure that you are doing everything you can. As far as supplements go, there's some research on the what's that mushroom out there, the lion's mane. I was thinking wolf's head, but no, it's lion's mane. Lion's mane mushroom has been shown to be helpful. Phosphatidylcholine, phosphatidylserine is helpful as well. Anything with nitric oxide to help drive that blood flow to the brain as well can be very helpful. Bridget, great to see you. SA, and is that South Africa, I'm assuming. Elisa, blood sugar waking is usually around 90, but my mid-morning is spiked higher than 130 to 140. But then after lunch, hold on, let me see if I can see the whole message there. But then after lunch, it's back down in the 90s. What could be doing? The blood sugar is going to be 85 to 110 all day long. If you're hitting 130s and 140s, it is going too high. And guess what? It's something that you're putting in your mouth. So you need to change what you're eating. Try a different breakfast. Try a different mid-morning snack. Whatever you're doing, something is making that blood sugar go up. If you're hitting 130s, 140s, it is going too high. It shouldn't be over 110, maybe 115 if you've been pre-diabetic or something like that. But it should be a lot lower than 130, 140. You know, if that's the whole story, you're in the pre-diabetic to diabetic range if you're hitting 130, 140 all the time. So you've got to get that down. Check what you're eating. Check what you're putting in your mouth, and that's going to be the first place to go. Hello there, Mindy in Tennessee. Rachel, great to see you down in Highlands Ranch down there. Suzette is on as well. Joel, I've had vertigo since November 7th. It's horrible and I can't get rid of it. Why won't it go away? Well, again, you know, I don't know your case specifically, but you've got to figure out the why. If somebody's got vertigo, you've got to look into why. You know, why would the body be thinking that it's moving and shifting and all those things? Sometimes it's a viral infection. So a viral infection can cause damage into that ear canal. It can cause inflammation, different things like that. So was it after a viral infection? If so, then you've got to do everything you can to get down that inflammation to help make sure that immune system has dealt with that virus. Sometimes it's the crystals in the ear, and that's the Epley maneuver. Let me know where you live, Joel, and I can, or Jolene, I can give you some recommendations there. But look for somebody that does the Epley maneuver, and that can be really helpful. Sometimes it's a brain-based thing. We need to do some eye exercises, some different things like that. So a lot of times it is inflammatory. All right. And so again, pop those down below. Charlene, great to see you. Put your questions down there. Yeah, Sharon, chiropractic can usually help with that. Absolutely. Occasionally it is just a straight up neck adjustment issue, but most chiropractors, they'll know that Epley maneuver as well. So if you have a chiro that you've seen, double check with them. What are your thoughts on home brewed colloidal silver? Yeah, we've done it ourselves. We have the silver wands, and we put the batteries together, and you get colloidal silver out of there. Colloidal silver is a great a lot of things, antimicrobial, bacterial, viral, a lot of different things. It's really good. Some people take it on a daily basis. Their big concern with colloidal silver is, oh, you're going to turn blue. Well, I've seen people drink a lot of colloidal silver and not turn blue. Obviously it's something that you want to think about, but it's not really this huge concern in there. So, great. Go ahead and do it. If you're coming down with a cold or flu, things like that, definitely a good place to go as well. That colloidal silver can be really helpful. The nasal spray is probably one of the best places to go with it. So you can put it in your little spray bottle and go psh, 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 and do it up the nose, especially after coming back from being out in public. All right, Charlene, what is the best remedy for Raynaud's and Sjogren's? I have both. Great questions. And here's how I would want that question to be a little bit different. What is the best remedy sounds like what is the best pill, what is the best thing. But here's what is the root cause of Raynaud's and Sjogren's is the really important part of it. And so the answer is both of those have an autoimmune component to them. So you probably have high ANA. Raynaud's, if any of you don't know what that is out there, if your hands get really red or really white, if they get cold, they're going to turn colors or go pale white. A lot of different ways to do it, but it's a circulation issue. Sjogren's is going to be autoimmune to the cells around the eyes that do the liquid, so you could get dry eyes, dry mouth, a lot of different things. So those are both autoimmune conditions. Brittany, go ahead and pop down our YouTube channel on there. Check out our YouTube page. I've got a whole bunch of videos, over 500 videos. You can search in there way easier than Facebook and search for autoimmune, tons of them. I've got full hour-long workshops, all types of different things. But autoimmune, you've got to get to the root causes. You've got to look at blood sugar, adrenals, leaky gut. Is your vitamin D at 80? Do you have any chronic infections, environmental issues like mold? Are you eating gluten every day or food allergens? What are you doing to get your body as healthy as possible? Because that is how my mom healed from her MS. That is how my wife healed from her autoimmune to her brain. That is how we get patients all the time that are reversing and repairing from these autoimmune conditions, is you have to get to those underlying whys. So check out some of those other videos. Got tons of stuff out there. Hey Kim, great to see you. I got that. I sent that email over. Let me know if you got that one with those results. Awesome, Jolene. Yeah, go there, get that fixed out. My atlas slips in and out as it chooses. I get how it could affect smell and more. Lana, yeah. So if you're C1 is that first vertebra in the neck, and the vertebral artery goes right through it. It's the blood flow to the brain, and so if that gets out of place, that can affect blood flow to the brain. So. All right, hello Dioduta. Hope that's how you say that. Welcome from India. Everybody say hi in the U.S. to India. More info about Omicron. Well, here's everything I know at this point. The research is showing that it spreads fast, whatever that means. That it's more contagious or whatever. But they're saying it spreads faster than Delta, and yet. I've only heard of one death associated with Omicron in the entire world. So everything I'm seeing, even out of South Africa, everything is that it is way less problematic. Even people that are getting it just aren't getting as big of symptoms. Here's the great thing is that if you've had COVID, the research is out there and it is showing that you have almost a 0% chance of getting reinfected and absolutely a 0% chance of dying. I have not read a report. If you guys have seen any out there of showing, all these people are dying from getting reinfected, then that would then that would change things, but we are not seeing that. And think about this. If that was happening, you would see all these retirement homes, assisted living, all these things, they would be having outbreak after outbreak after outbreak because they had a lot of people that already got infected, and you would see infection and death over and over and over. But kind of once it goes through and people have had their infections, we're not seeing reinfection from that. So this Omicron may actually be the best thing that we have going, because people are going to be able to get antibodies, get natural immunity, and it's not very intense as far as the symptoms go. So it sounds like it's more of a flu, cold type of an issue, pretty mild. And so if that can give us antibodies, give us natural immunity, this might be the best story we've heard in a long time in this whole COVID saga. So again, early intervention is crucial. I know over in India you guys have a lot of ivermectin, you've got a lot of supplements, a lot of herbs, traditional herbs and things like that. So, use all of those things. Early intervention, we sent an email out today. If you're not on our email list, direct message us or pop your email down below, and we try to get lots of good information out to you in regards to all different types of things health related. But we sent one out this morning, and it was all about early intervention. And we're not saying that that one thing ivermectin works, or zinc is the only way, or NAC is the only way. It's a broad spectrum approach. You probably need to be taking aspirin daily if you have COVID to prevent blood clots and anything going on in the lungs. There's antibiotics that can be helpful. If it gets bad enough, you need to be on prednisone. So there's a lot of things. I'm not anti-drug if it's appropriate. And here's the thing with early intervention is you've got to do this shotgun approach. Prevent people from going to the hospital. Once you go to the hospital, that's when we've got issues. That's when people go on ventilators, their pulse ox crashes down, all these things. So monoclonal antibodies, all of these different things. Unfortunately, some of the medications they're using in the hospital are not very helpful and actually can cause a lot of problems. So early intervention, stay out of the hospital, is crucial. So thanks for jumping on from India. Good to see you there. Tiffany, you got monoclonal on day 3. Here's the deal. If it's hits you like a ton of bricks and you can't even hardly move, okay, maybe on day 3. I'm guessing that it probably wasn't day 3 for you. That was probably day 4 or 5. You just maybe didn't realize it right off the bat what was going on. So usually by, it's not just like on day 1, 2, boom, it hits you like a ton of bricks, and day 3 you go. Usually it's kind of crept in for a couple days through there. But for most people, they're not going to need monoclonal antibodies. Thanks for the hearts, guys. Love having you on. With this information, share it with anybody that you know out there that has questions. They can always come on every Thursday morning. We do the live Q&A. So Tiffany, not everybody needs monoclonal antibodies. If you're 25 years old and you come down with COVID and you're tired and whatever, you're probably going to get over it in a week. It's probably not going to be a big deal. You're probably not going to need to go get monoclonal antibodies. If you're 50 and you're overweight and your inflammation is through the roof and you've got prediabetes and all that stuff, you might want to think about it by day 3, 4, 5, be planning on where you're going to get it. So at least plan on it and know how you're going to get those monoclonal antibodies if you're going to be doing that. Hey, Don, great to see you down there in Tennessee. Let's see what other questions. Christy, you are so welcome. Great to have you on. Susan. Susan is starting school to be a holistic doctor in the spring. Great job. Which program are you taking, Susan? Amanda, CRP came back at 33.5, and I also have bacterial infection, low iron, and very low vitamin D. What do you suggest to treat? Hold on. Let's see if I can see. Treat at home. Is what I'm assuming. Sorry, it's not popping up there. What do you suggest to treat? So here's the deal. C-reactive protein is an inflammatory marker. It really tells us about inflammation anywhere in the body. Over 3, it's potential cardiovascular disease. Over 6 or 8, it's tremendous inflammation. I haven't seen that one in a while, up at 33.5. So what you've got to do is figure out where that inflammation is coming from, and then wind it down. And so it could be that bacterial infection. Look for your white blood cell count. If it's under 5, that's a chronic infection. It's been there for a while. If it's over 8, that's acute infection, and you're dealing with that bacterial infection, major infection at this point. Low iron, if there's bacterial infection, low iron, look for H. pylori. You probably have an H. pylori infection, which is going to cause irritation, leaky gut, a lot of different issues through there. And then that'll be some low absorption with the vitamin D. If it's very low, if it's in the teens, you might need 15,000 a day for a while to get that back up. Recheck in 2 to 3 months. Make sure you're not going too high, but you've got to get that vitamin D up. That C-reactive protein could be blood sugar as well. Start checking your glucose. Check in the blood work. Check non-fasting insulin and non-fasting glucose. See where those are. But it could be a blood sugar thing as well. But they're 33.5, usually some type of major infection going on. It's probably H. pylori. You're probably irritating that gut lining. Low absorption, and you're losing iron. Iron and glucose are the two things that are needed for energy in the body, because iron transports oxygen around. So you've got to get that down. You got to figure out the whys. Angela, my good friend, is suffering from antidepressants withdrawal still months later. Any tips on how she can cope with that? Some of the things that you can look into are 5-HTP. 5-HTP is a precursor to serotonin. So that is a good place to start depending on where you guys live. Get a brain map done and potentially do some neurofeedback. That's going to be a huge part of getting those brain waves into the right range. You could do some inositol as well, and get outside, get exercise, go for a walk in the park, in the woods, whatever you can do to get outside, commune, and pray. And that's the faith. It takes a whole lot with the antidepressants and that depression as well. So Jolene, you are welcome. Paula, why do all foods burn in the mouth? Paula, that can definitely be. Send me a picture of your tongue. If you've got a white tongue, we can definitely have some yeast overgrowth, potential thrush, things like that. In which case, you want to take Saccharomyces boulardii, which is a soil-based organism, open it up in water and gargle that in your mouth. So that's going to be one of the first places to go. Is there may be some bacteria, yeast imbalance in the mouth? So check that out. Send me a picture of your tongue there. What is best to take for muscle pain? So magnesium would just be a supplement that would be great just to start taking on a regular basis, but you got to figure out why you have muscle pain in the first place. Usually it's because the body is not repairing and rebuilding. So the first place you need to look is, are you getting good quality sleep? So if you're not getting good quality sleep, you're not going to be repairing your muscles. Just like I did a workout the other day and did some triceps, and I like put on my shirt today. I'm like, that's still kind of sore. That's good, But it was because I exercised a bunch, not because I didn't get sleep and my body's just not repairing itself. So muscles break down every day, but if you're not repairing, you're not going to be getting that muscle to rejuvenate, and you'll still be having pain and some of those things. So magnesium is going to be a great place to go. You can do some Epsom salt, sea salt baths. Those things are going to be good, but ultimately figure out why the pain's there in the first place. It's also potentially an inflammatory process. So just like the other question about the C-reactive protein, check your CRP and see where your inflammation is at. Let's see. Is intermittent fasting one of the best ways to help get blood sugar balanced? Gina, we don't do it. We don't do it with patients. We don't need to do it. The best way to get your blood sugar balanced is to watch what you're putting in your mouth. If your blood sugar is going up too high when you test it, don't eat that. If it's staying good, eat that. If it crashes, eat more fat, eat more protein, whatever before, so it doesn't crash. So intermittent fasting, unfortunately, is very stressful on the adrenal glands. So maybe post-COVID, just to get the cells replicating and regenerating faster. But otherwise, we really don't recommend intermittent fasting very often, especially in the early stages of somebody's program. One, we just don't need to, especially if you've got that continuous glucose monitor. All new patients start with it. We get the patch on there, and we see every 5 minutes where that blood sugar is. So it's not going to be one of the best things there. Holly, let's see, my husband test showed he had too much iron in his blood. What can cause this, and what can be done to help reduce it? I always say if there was only one marker that we could test on everybody, it would be what's called ferritin. Ferritin is our stored iron. If somebody is over 125 in a female, over 150 in a male, they are too high on their iron and ferritin. Very rarely is it because they're taking too much iron. It's almost always because it's an inflammatory condition. The liver tells the body to store more iron, and that inflammatory condition, we also see high triglycerides, high C-reactive protein, the inflammatory marker, high blood sugar, insulin resistance, potentially fatty liver, all these things. So if I see high ferritin, I guarantee you his blood sugar is not where it needs to be. It may be that 1 in 1,000 that's just a genetically high, and his blood sugar may be perfect, and his triglycerides are perfect, he doesn't have insulin resistance, all that. But I am betting that, because I haven't seen it in years, that somebody's ferritin is high, but everything else is perfect. So we've got to start with that underlying imbalance in there. Mary, I have food grade hydrogen peroxide. Can you tell me what the ratio to mix in to gargle with? I'll just throw it in my mouth straight up to gargle with it. So I don't usually dilute it for there. You want to dilute it if you're doing the sprays, but to gargle with it, I'll just do it by itself. What's the cause of a low-grade fever for 5 to 10 days with aches all over the body? I'm on day 7, but finally. So it's got to be some type of infection. Could be bacterial, could be viral, anything along those lines. Bump up that vitamin D. I would really help it along. I would do the hot bath with the frozen sock routine. We've got that on YouTube. So you could do that one and just really kind of jumpstart that fever, burn it out, get it over with. Is going to be good. Can weight gain happen with the start of menopause? Absolutely, Michelle. Anytime there's hormonal shift, one of the things that can happen is every time there's an estrogenic event, like going through menopause or having a baby or whatever, you can stimulate autoimmune. So you could have developed Hashimoto's just going through menopause. It can also be that your testosterone crashed. Check out your testosterone, probably from your DHEA going low, and that's probably from a chronic stress reaction in the body. But again, you want to start with the foundation, start with blood sugar, start with liver, gut, any of those issues that may be out of balance as well. How do you test for variants? I don't, and I really don't. I actually don't get it how they do it, and try to say that they can tell which is which. So, because if you call a lab and say, hey, can you tell which one I'm getting? The labs will say no. Hey Michelle, no wind up there. Yeah, it's been windy down here. Patient in Casper yesterday said that they've had 90-mile-an-hour winds for a week straight. That's a little extreme. Hey Angela, we will get you on the email list. And let's see, David and Carol, we'll get you guys on too. Allison, we'll get you on. And Lorraine. Yeah, Rhonda. So some type of infection is going on there. Patty, yeah, great guys. So if you're not on our email list, go ahead and pop those down below. Angie, premenopause and now have high blood pressure and cholesterol. What are some ways to help bring it down? So almost always, remember, you guys that have been with me for a while, if you see high blood pressure, there's almost always a high blood sugar component to it, and that same thing with that cholesterol. So you've got to stabilize that blood sugar. Start checking your glucose. Brittany can pop down a glucose monitor that you can pick up there, and you want to check that blood sugar, make sure it's not going up too high, make sure it's not going down too low, but that is usually what it is. And I am going to have to jump here. Hey, Gina, thank you for the stars. All right, guys, love having you on. Remember, pop those questions down below. We'll be watching these for the next few days. If you're watching the replay, even pop questions down there as well. Love having you on. Share this with anybody that you know that needs information, that needs hope. Your body can heal. Your body has that potential inside of you to be vibrant, vital, have healing with any condition out there. So love having you on, love bringing the questions. These were great ones today. And if you've got ideas for anybody else that asks questions, help them out. This is a great community. People are always sharing information. So stay strong out there, everybody. Take care.